Okay, you know that still talking on infertility in women. Um, I last time mentioned some structures that are involved in fertility in women. Today, I want us to look at the vagina. We look at the uterus, that is the womb. We look at the ovary. And then we also look at the brain because the brain plays a very vital role in handling fertility. So let's start. The vagina. What is the role of the vagina in fertility? Does the vagina really play any role? Yes, the vagina plays a role in fertility. Number one, remember that during sexual intercourse, which is a must for conception to occur, there must be sexual intercourse. So during the sexual intercourse, the vagina is that part of the woman's body that receives the penis during sexual intercourse. So the vagina receives the penis, and the sperm or the semen from the man is deposited at the posterior part of the vagina. That's the back of the vagina. So I've mentioned two functions now. Deposition of sperm is handled by the vagina. Two, receiving the penis during sexual intercourse is also done by the vagina. Okay? So if you have been thinking that the vagina doesn't have a role, no, you're not right. The vagina plays a role. Okay? Sometimes there may be some problems with the vagina that may impact on fertility. Have you thought of it? What is it that can happen to the vagina that can make a couple or affect the fertility goal a couple is working towards? Number one, you know there can be cancers anywhere in the body and the vagina is not left out. In fact, the vulva, that's the exterior part of the woman's genital area. There can be a cancer of that part of the body. A cancer can occur anywhere in the body, and cancer in the vagina is not left out. So a cancer of the vulva is that part of the woman's body where you have the clitoris, you have the labia majora, and you have the opening of the vagina outside now. Yes, that's the vulva. So there can be a cancer there, and it will affect the vagina from performing its role in receiving the penis during sexual intercourse, and also for the deposition of the sperm during sexual intercourse. So you see, the vagina has a role to play. Now, secondly, there can be what we call septate vagina, where you know, of course, you know the vagina is an open, it's like a tube. But for some people, instead of it to be an open tube like that, it will be as if there is a septum dividing it into two halves. Of course, when that kind of abnormality occurs, it's difficult for that woman to have sexual intercourse. It will be difficult because the man's penis can't get in there comfortably. It becomes a problem. So a woman that has that problem or that has that malformation rather, it's not a malfunction, it's a malformation that now leads to the malfunction, yeah? Yeah. So a woman that has that malformation will find it difficult to enjoy sex. And of course, that will also affect fertility. We know that there are infections that can occur in the vagina, infections of the vagina. When there is infection in the vagina, it can be bacterial, it can be viral, any infection at all. This infection will lead to vaginitis. What is vaginitis? Inflammation. That is, the vaginal area will become inflamed. And when this happens, the vagina is going to be painful. That area is going to be painful and tender. If you touch it, it will be tender. That is, the person will feel pain. So a woman that has this kind of problem will not comfortably have sex. So when this happens, is going to affect fertility, because this woman will always be complaining of pain, 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 because of that infection in that part of the body, the vagina. The woman will always have pain and she won't enjoy sex. And remember, we've talked about regular sexual intercourse. Sex is supposed to be a pleasure. When it becomes painful and discomforting, it's going to impact on fertility, directly or indirectly. Okay? And then the last point I want to talk about is cancer of the cervix. The cervix is a part of the uterus, that is a part of the womb, but it opens into the vagina. So women that have cancer of the cervix, when this happens, when they have intercourse, they start bleeding. Because when the penis touches that cervix, which is at the upper part of the vagina, when this woman has sex with her partner, she'll start bleeding. It might not be painful, but she may bleed. So that bleeding may make her to be avoiding her partner. And of course, we've talked about frequency of sexual intercourse that can lead to fertility or conception. So in my next video, I've been able to tell us about the vagina in this video. In my next video, we'll be looking at the uterus or the womb. Thank you. See you next time. Bye-bye.